we're going to focus on those soft tissue procedures. It's kind of the traditional, the most tried and true and tested way of getting this type of treatment done. But that being said, technically speaking, there are a lot of different ways that you can treat root recession and root exposure. So not only from that left side that we're familiar with, can we do the soft tissue, free gingival or connective tissue grafting that we're going to discuss, but you technically can use a membrane. In the process of GTR, a membrane can be used over a recession defect and achieve root coverage. So not everybody is aware of it. The reason we don't use that on a regular basis is because soft tissue in comparison tends to be better, but it is still an option. And of course, biologics, which we'll touch on as we go forward, and some different techniques with coronally positioned or pedicle flaps of your existing tissue can also be an alternative that can be done. If I was to grab your lip and pull outward, and you were to see that the area where that frenum attaches near the gingival margin causes blanching around that gingival margin, that will be a good clue for you that that frenum attachment is so high up that it actually is going to be requiring release to prevent any further apical movement. So that's a very good and easy trick that you can use at all time. Now, the good news is treating this type of an issue is extremely quick and very easy via a frenectomy. We simply make a diamond-shaped incision at that frenum attachment and can release that frenum pull entirely. Now, whether you do that with a classic 15 blade or you decide to use a laser, of course, both options completely work. We look at kind of a basic classification of recession. They've got multiple different classes. And in a class 1 recession, the soft tissue will remain coronal to that mucogingival junction, and we have no bone loss. In that situation, we can, with very good confidence, know that 100% root coverage can, in fact, be achieved. Now, in a class 2 recession, that soft tissue will progress either to the mucogingival junction or more apical to it. However, as long as our bone is still completely in ideal position, we have zero bone loss of any kind, we can still very confidently plan on being able to aim for 100% root coverage. It's when we get into class 3 recession where we still have that mucogingival junction, that soft tissue extending at or beyond it, but what ends up happening in this situation is when we first start seeing signs of bone loss. And if it doesn't matter if that bone loss is 0.2 millimeters of bone loss or 1 millimeter of bone loss. The bottom line take-home message for everybody is, as long as you have some bone loss occurring around a tooth, 100% root coverage is no longer attainable. And of course, the worst situation, which of course we would never want to treat, class 4, we've got tons of soft tissue and hard tissue combination defects. Of course, while that picture is a little bit sad right now, considering what just happened on the news, but I promise you that slide was there before. That is an abandoned ship, though. That is a situation that is not going to be successful. Now, I did touch real quick upon biologics, and biologics have become a huge thing, mainly within hard tissue augmentation, but it has been used for soft tissue augmentation as well. We are now capable of drawing a patient's blood and using a centrifuge to separate their platelet areas and get growth factors from there to enhance hard tissue healing. But we can also mix that with some of our soft tissue to enhance the overall healing time and overall result that we get as well. But probably the most popular and well-known of a biologic that helps with soft tissue is Emdogain. Now, Emdogain is an enamel matrix complex of proteins, and basically what it ends up doing is that it is tricking our body into thinking that the natural tooth formation is going to be going on and happening. And by doing that, by mimicking the biologic process of natural tooth development, now if our goal in our mucogingival deformity case is to have an increased zone of attached gingiva, if we have an area that is all mucosa and we're trying to reestablish some very good attachment, there is no better source and no better technique to achieve that than doing a free gingival graft. The good thing with a free gingival graft technique from a surgical standpoint is if we also do have a frenum pull, we can address that and do the frenectomy with the free gingival graft at the same simultaneous visit. Our other option is to do a connective tissue graft. And this is now kind of considered to be, in terms of root coverage, the gold standard because of the reasons of not only getting an excellent aesthetic result, but also because of the lack of discomfort from the patient side on that donor side on the palate. The classic Langer technique there, you can see both of those premolars, the graft there in position, and you can see from start to finish that increased amount of root coverage that we achieved and we were able to get. And this was a case of ours that we used cyanoacrylate, being basically a glue in the mouth that will help secure that graft into position. That is another option that you have and another example of how these types of grafts can be done. The beauty of AlloDerm, as you can see, is that we can have as much material as we want. So we are not limited on the supply and the amount like we are with the free gingival or connective tissue graft. And this is the type of closure that you're going to require in order to be very confident with an AlloDerm material. So a little bit riskier in terms of that, a little bit more important from a case selection standpoint. In comparison to connective tissue over the long term, our own connective tissue is still going to be better than AlloDerm in terms of long-term results. However, in terms of having an alternative that is still very effective, and for those patients who are just too terrified or flat out refuse to use their own soft tissue, it does give us another option. However, as much as everybody loves to do connective tissue and free gingival grafts, of course, some patients are terrified and or flat out don't want to do that. So we want to talk about some non-surgical alternatives that can exist to treat these areas. Now, there are multiple different options that Voco has in terms of fluoride varnishes, and we're going to go through a couple of them. One of them is called pro-fluoride varnish, and you can see is a 5% transparent sodium fluoride varnish material. What's very good about all of their products is that they've got this high immediate fluoride release. A lot of different varnishes that are out there, the fluoride release is done at a much slower and more gradual pace. But with the Voco products, it is a very high concentration and immediate amount of release, which is why they are able to achieve such a good anti-sensitivity type of result and therapy for it.